So what can we do for these patients? Well, obviously their cells need oxygen. So the first thing we want to address is that hypoxemia. And we do that by giving low flow oxygen. And we keep it low flow by limiting to just 2 to 4 liters per minute, or preferably using a Venturi mask. A Venturi mask is a great option because we can very finely titrate that oxygen concentration to prevent giving too much oxygen to these patients. So they are very, very sensitive to oxygen toxicity. And if we give too much oxygen, you can even suppress their respiratory drive. So titrate to keep their pulse oximetry reading no higher than 88 to 92%. And we will want to teach them to use their pursed lipped breathing. So we're going to have 2 steps. And remember, these patients have trouble getting air out. So they're going to want to inhale through their nose and then exhale for twice as long through pursed lips like this. We don't want them to puff out their cheeks because pursing their lips creates just enough backwards pressure to help hold the alveoli open and prevent them from collapsing during exhalation. So we don't want that pressure going out into their cheeks. We want it going backwards down into their alveoli. So we want to prevent the disease from getting worse, and we do that with smoking cessation teaching. So only if they quit smoking will the disease stop progressing. We also want to prevent infection because if they get a respiratory infection, this can precipitate an acute exacerbation and may even require hospitalization. So make sure they're practicing good hand hygiene and getting all the appropriate vaccinations, like their annual flu vaccine and their pneumonia vaccine after they're 65 years old. And these patients have a lot of activity intolerance, so you'll want to teach them to alternate periods of activity and rest, and to try to sit during their ADLs when possible, like using a shower chair.